All right, my Psychians, we are finally on our last video for our Unit 8 Part 2, and is the Biomedical Therapy side. So we just went over all the psychotherapies, which were through our lenses, no medication needed, and now we are going to dive into the mental health disorders, if severe enough, that may need some medication help. And again, I just want to preface where, there could be some negative stigmas around, people taking medication for mental health. And I just want to let you guys know that's not the case. It is okay to, seek help if needed. And remember, you know what's best for your body. But there is also some things to think about when taking medication, because whenever we put anything into our evil drug lord brain, there is side effects, right? So we're going to talk all about that. And let's get started, my friends. So biomedical therapies, this is module 73. So, and there's a lot going to be going on, so I will let you know what I would like you to write down, okay? So first things first, I would like you to write the definition of antipsychotic drugs. So antipsychotic drugs first started to come about in the 1950s, and their main goal was to block dopamine activity. And already in your heads, I want you guys to be thinking of, blocking dopamine. What mental health disorder are we talking about? Schizophrenia, my friends. So in our top corner, we have our little definition for our book. So drugs used to treat schizophrenia and other certain forms of severe thought disorders. So again, but the main one we're looking at for antipsychotic is schizophrenia. Because remember, antipsychotic is the dissociation of reality, right? So antipsychotics, schizophrenia, okay? And so while it's effective, these medications do have some side effects that include sluggishness and tremors, and along with tics, which there is actually a term for it now. It wasn't in our old textbook, but let me move my camera so you can see. So side effects, sluggishness and tics, and other involuntary movement, and it's called tardive dyskinesia, which is lowering our white blood count and weight gain. But the side effect that you see the most is people who are on antipsychotics for a long time and all of a sudden stop. They tend to have certain tremors of withdrawal of antipsychotics and tics. And that's also what our first responders and policemen are trained to look for, because if someone is off their antipsychotic medication, there could be reasons for what their behaviors are showing, right? And also there's a dissociation from reality. So it also allows people to be aware of what their mental state is. And so that was first generation. The second generation of antipsychotics came out and were developed in the 1990s, which block both dopamine and serotonin activity. Okay, so that was kind of a newer modification, and the side effects were less severe, but they are still significant. And what I would like you guys to write down is, so here is some examples of typical antipsychotic generic names and their trade names, and I want you guys to write. So for typical antipsychotics, I would like you guys to write Thorazine and Proloxin. Okay, those are the two. Thorazine and Proloxin. For people who are allergic to the zine part of antipsychotics, which is a chemical within it, they usually do clozapine, or you might have heard clozapam. So clozapine, I would like you to also write down for the atypical antipsychotic for anyone who might be allergic to the typical ones, which is Thorazine, which is the most prevalent, and Proloxin. And if you could write down clozapine, you don't need to write down all the rest. I just wanted you guys to know, for psychiatrists, they have to learn all of these things, okay? So that is the trade names for the typical medications. Okay, so those are antipsychotics. So now I would like you to do a little scribble. And now we're going to talk about anti-anxiety medications. And we also will talk about antidepressants, and they do tend to overlap. So there's some medications that do overlap. It all depends if you have both depression and anxiety, or if you have one or the other, or if one leads to another. That makes sense. So if you have depression and it leads to anxiety, it's different, okay? So there's a lot of little layers going on. But for anti-anxiety medication, the main one are, we call them benzodiazepine, but you could also hear them being called benzos, okay? Benzos. My friends, benzos can get addicting. So when we talk about these medication aspects, when we put things in our body, our brain is then told we don't need to produce anymore, right? So when we are off the medication, that's when things can get a little dicey, right? So benzos alleviate anxiety by increasing levels of GABA. You want to have that in your notes. Benzos alleviate anxiety by increasing GABA. And remember, GABA inhibits our brain activity. It's like putting a weighted blanket on our brain to calm it down. It reduces brain activity. It calms it down. Because remember, when someone has severe anxiety, the brains are always going, right? So it's almost like a weighted blanket for your brain, okay? So GABA helps reduce anxiety. And we naturally produce GABA, but that means that we need more GABA and that's what benzos are for. Side effects, my friends. Negative interaction with alcohol. That one is a very, very common with a lot of medications because remember, some medications allow more to go through. And remember, alcohol is a depressant. So if you put a depressant in your body and then you have a bunch of stimulant going in, my friends, our heart can only take so much. So that's why there's negative interaction with alcohol. It decreases coordination, motor function. So sometimes, if someone is on a strong enough medication, sometimes they shouldn't be driving or in certain situations, because remember, GABA helps relax our brain. If our brain is relaxed, so is our motor, right? Because alcohol also depresses. That's why if you add alcohol to benzos, it's even more depressing your nervous system, which could cause delayed motor movement while driving, right? Or you might stumble, right? And there is a risk to psychological and physiological dependence. Again, anything we put into our brain, just like me drinking caffeine, can create a dependence, right? Or a tolerance. So, and also, it's very common for people who are taking medications, especially like in higher up dosages. They might switch their medications like either every year, every 2 years, because our body does build a tolerance and we never want to keep on adding more and more and more, right? So it's almost like switching from Advil to Tylenol. Just to make your body's tolerance go away. So that's also very common with this medication side. And other medications have been found effective against anxiety. My friends, there's a lot, and there's a lot of crossover, including some antidepressants. Buspar is a non-benzo, so if someone has been, so if people get addicted to benzos and they want to get off of them, they usually go to a non-benzo concentrated medication, which is Buspar. But my friends, for what I want you to write down, so for benzos, Valium. I would like you to write that down. Or diazepam. Well, that's the same thing, yeah. So Valium. And I also want you guys to write down Buspar for the non-benzodiazepine. So again, just in case people are allergic or it doesn't work well with their systems. So there's always the two. Okay, now another squiggle, my friends. Mood stabilizing medication. Right next to this, I would like you guys to put for bipolar disorder. Remember, we cannot treat bipolar by giving antidepressants, because what is that going to do? Skyrocket them into mania. And also, if we take away the mania and take away the stimulant, plummet them down to depression, my friends. So again, we cannot give people who have mood disorders antidepressants or stimulants, okay? So what they have found, and this makes I don't know the exact chemistry behind this, but lithium is it, my friends. Lithium is a naturally occurring substance, and it's effective in treatment of bipolar disorder, especially the manic phase of the disorder. When we talk about certain mental health disorders that need medication, schizophrenia, mood disorders. It's very hard for someone to have a mood disorder to go on with daily life dealing with the ups and downs. It is highly recommended to have medical treatment along with therapy attached. So they don't just give you lithium and say adios. Usually people who are bipolar also have cognitive therapy attached with their medical medicine prescription as well. So mood stabilizers work by regulating the excitatory neurotransmitter of glutamate. Okay, it regulates glutamate. This mechanism of action for lithium, however, is still being researched. I believe, I'm not sure if there's any new studies, but again, it regulates our excitatory nervous system. And there's an anti-convulsant medication called Depakote. So the Depakote has also been found to be effective in treating bipolar, but again, the main one that you want to focus on is the fact of lithium. Yes. All right, moving on, my friends. So we just talked about our mood stabilizer. Now we are going to move on to our serotonin reuptake. Oops, and that little portion is cut off, but don't worry, I will help you let you know what it is. So serotonin reuptake inhibitors, and here, let me see if I can get the screen a little bit better for you. All right, my friends, sorry, I'm back. That was a screen malfunction, but it's okay. So our next squiggle, we are going to talk about, so now we're getting into antidepressants, which are also called, with medication usage, is SSRIs medication, which is selective serotonin reuptake inhibitors. Whoa, say that a couple times fast. So when we talk about antidepressants, there's a few things that's going on. So when we talk about depression, we know that there is a lack or a lower of serotonin in our chemical balance within our brain. So what SSRIs do is they increase the availability of serotonin at the synapse. So you remember how reuptake happens after Nancy the neuron is fired and the neurotransmitters pass through the synaptic gap, and there's a process called reuptake where they grab the extras and absorb it. This stops that from happening, and it allows more serotonin to go through. Okay, allows more serotonin to go through. So neurotransmitter activity immediately is affected, but therapeutic effects may take a few weeks. So usually when people go onto medication, it's not an immediate response. Our brain has to slowly adapt. So it usually takes 2 weeks-ish, I would say. And as the medication gradually stimulates the hippocampus and parts of our brain, that is when the effects start to happen. So again, it's not immediate, but it does take some time, and once it is in your system, okay? Side effects depend on the antidepressant, but usually the ones that are very common is dry mouth, constipation, and also there is the aspect of decreased sexual arousal. So a lot of people who take antidepressants, their sexual urges go down as well, which is a side effect. And then, this is increasingly also prescribed with treatments of anxiety. So SSRIs can be used for both depression and anxiety. And the most commonly prescribed of this group is Zoloft and Paxil. So those are the ones that I hear a lot that are prescribed. And again, it's where we are allowing more serotonin to go through. So our SSRIs are going to be agonists. Okay, they're agonists. All right, next squiggle. So, all right, let him go. Okay. So there is alternatives to medication, right? And again, we just talked about our psychotherapies. Not everything needs to be medicated, right? But there is also some things that need to be, right? There's some aspects that we may need the chemical imbalance help, right? So for herbal remedies, some evidence exists that herbal products such as valerian root from St. John's may alleviate the symptoms of psychological disorders. There's also herbal remedies that are, that are kind of well regulated. There is some stats on it, but also we want to consider the placebo effect as well. There's not we're not sure how much it helps. There's a lot of factors going on, but there is some herbal remedies that some doctors will suggest for those who want to avoid the medication route that could help with chemical imbalances. But again, it's very hard to get stats because there's the placebo effect, right? Is it actually working? Do we just think it's working, right? So just something to think about. Other types of therapies. So now we're doing another squiggle. This one's not under biomedical, but it's a different type of therapy, and it's used for treating depression. ECT, electroconvulsive therapy, only certain institutions practice it. So you can't just go to a regular doctor that's maybe under the Kaiser realm and say, hey, can I get this electroconvulsive therapy? It's only for, I think you have to get referred, and it's used to treat severe depression. Okay, severe depression. And how it works is it passes electrical currents through the brain via 2 electrodes on the scalp, and it seems to reset the hypothalamus, our janitor, which is in charge of everything that's secreted and stuff. And as a result, they believe our hormone levels are recalculated, they're readjusted. We're not really sure if it's what really helps the symptoms of depression or not. Again, it does have mood altering effects immediately. Again, it's very still kind of being researched. And then there's side effects of using today's methods of ECT are very small but limited, but it can affect memory. Some people do have mild memory loss, but much of the public worries are still on the safety aspect of actually having things like being electrodes being set in your brain. So it's kind of still new. Not a lot of places will do it, but there is options in some areas. And I believe you have to get referred. Now let's talk about something that is the extreme of the extremes, my friends. Oh my goodness. Psychosurgery. Let's just listen to that. So my friends, before I go into this, I already talked about how really, really dangerous spinal surgeries are, right? Imagine brains being just as bad. Doctors will never be like, oh, plan A is to open up the brain and plan B is my people. This is the last resort, and very few, you will have to find a very specific, it's not a lot of doctors will do this anymore. And it's called a lobotomy. So it's a rarely used procedure that involves the irreversible surgical destruction of certain brain areas. My friends, don't do it. A lobotomy completely severs the link between the frontal lobes and your limbic system. That is your emotion system. I'm talking amygdala. I'm talking everything. Happy, sad. It is severing that connection from your frontal lobe and your emotional system. I would be surprised if you can find a doctor that would allow these to happen anymore. It's only used, it's only used in the most extreme cases. That it cuts it off. You just have to know it's used in the most extreme cases. Lobotomies could ease a person's misery, and usually it was caused from hysteria. And the biggest case study that people kind of refer to is Rosemary Kennedy, who had to be institutionalized after she received her lobotomy, and it went wrong. She was a vegetable, my friends, for the rest of her life. And the success rate for lobotomies, very small. So it was used to treat mood disorders. So again, bipolar, hysteria. It was the extreme of the extreme, and highly would not recommend, my friends. Highly would not recommend. So, biomedical therapy effectiveness. Some really interesting stats. Antipsychotic medications, when they were introduced, look at right after 1950, right? Do you see that? And I was telling you how incarcerations for people who were mentally ill within mental hospitals were so, especially, and also in jails, were so high. And then right when the drug was starting to be released, look how much, look at the population decline because antipsychotics help people be able to live the most normal lives that they can. And again, I always hate to use normal, but mainstream life that they can. So, several types of psychotropic drugs have proven useful in treatment for various psychological disorders. The decision to use medication is always complicated because there is side effects such as, again, dry mouth, weight gain. Weight gain is very common for a lot of it. Remember, our thalamuses are very touchy. Not our thalamuses, our thyroids are very touchy. Again, with the decreased sexual desires, especially when side effects occur before the benefits of medication, they could be amplified. And remember, whenever we do put something into our drug lord brain, there is side effects. There is, ripple effects. But again, sometimes medication is the avenue and sometimes it's not, right? It's a spectrum. There's no set in stone. You have this, you need this, right? Maybe for schizophrenia, it's very highly recommended to use antipsychotics, but again, it's different for a lot of people. So thinking about the placebo effect, we kind of talked about it a little bit, but so here's just a few bullet points to take away. So they have found there is an effectiveness to the psychotropic medication is further complicated by the placebo effect because people can argue that, is the medication actually working or is it just making me think that it's working, right? And so research surveys have demonstrated that a large percentage of individuals with anxiety, depression, and other emotional disorders had significant improvement even after the placebo treatment. Because remember, mood, it's dictated by our mood. So if we think that we are being helped, it also might help alleviate those things naturally. Because remember, it's all within our thought processes. Improvement may occur also due to regression to the mean. So natural improvement would happen without intervention. So there's always that aspect of that we could get better on our own. But in cases of severe depression, the amount of improvement that is due to medication itself seems to be greater. So with severe cases of mental health, medication has been known to help for a bigger portion of it. Yeah. And so last slide, dangers of, and it says dangers of therapy. What I meant to say is dangers of therapy involving biomedicine. So medical therapy. My friends, just like when I talked about benzos, some medications, especially if they're overused or abused, can lead to dependency. Benzos are a really big one. People get and that is a very expensive addiction. Okay. And that is why giving people who are under the age of 18, it's kind of these big drugs, you have to, talk to a doctor. There's usually a regimen, right? So that's why you have to go through all these hoops because whatever we put into our brain will slowly adapt. And this can happen, right? We need more. So some antidepressants have been linked to increased suicidal thinking, but the direction of causation is not quite clear. These risks must be monitored, but must also be considered along with the risks of not prescribing medication. So there's risks to both, right? And especially in severe cases like mood disorders and schizophrenia, again, my friends, you need to know that those two, mood disorders and schizophrenia, lithium and antipsychotics, better to take it than not. So again, there's that aspect. And then of course, just like we talked about earlier on, misdiagnosing, misguided therapeutic practices and intervention, the overprescribing of ADHD early, again, there's just a lot of other factors you have to also consider. So again, that's why there's so many loopholes. There's not so many loopholes. There's so many loops to go through. And the DSM-5, you have to follow strict, in order to diagnose, we have to have the 3Ds and all these things. In order to categorize things, we have to have these symptoms. It's a whole, mechanism. But as we wrap up, I just want to let you guys know again that there is no shame in asking for help. There is no shame in having more people to talk to in your life. we have needs that need to be met, and everyone is different. And you shouldn't be thinking that, anyone's weak for taking medication for help, because everyone's cases are different. And I just, wanted to kind of clear up any of that stigma. So I hope you guys enjoyed our Unit 8 Part 2 lecture. I can't wait to start hybrid learning with some of you folks next week. And so you guys will be able to finally see my classroom. And I hope you guys have a great rest of your week.